bienvenido, Don Eddie. Él se dio cuenta rápido de lo que turismo médico representa. Compré unos pantalones de marca fashionable, francés, en $55. Me compré unos zapatos Hugo Boss de $347, me costaron $112. Tenemos un doctor en Chicago, en la avenida El Mile, ¿cómo se llama? El Magnificent Mile, graduado de el colegio de Holy Cross, con un doctorado en medicina en la Universidad de Puerto Rico, con un doctorado en medicina en oftalmología, con una especialidad en oftalmología pediátrica y estrabismo en la Universidad de Michigan. Y tenemos, en adición, en Case Western, hace una especialidad en cirugía plástica. Ese es un doctor que está en Chicago, en Mile High. Ese doctor cobra por un procedimiento facial $5,500. ¿Ok? Perdón, me equivoqué. Les acabo de presentar al doctor Pou. El doctor Pou está en Puerto Rico, en Guaynabo. Y el doctor Pou hubiera hecho ese trabajo por una tercera parte de lo que el doctor de Chicago lo hubiera hecho. Y las credenciales del doctor Pou ya se las expliqué y compiten de tú a tú con cualquier credencial de cualquier cirujano plástico en Estados Unidos. Eso es turismo médico. Turismo médico es que tener al doctor Pou en Puerto Rico, con la preparación del doctor Pou, con los trabajos que el doctor Pou hace, ¿ok? A una tercera parte, un 40-60% menos costo que lo que cuesta en Mile High, en la Magnificent Mile. Eso es turismo médico. Eso es el doctor Pou vendiendo los pantalones fashionables, los zapatos Hugo Boss. ¿Ok? Pantalón fashionable, francés, de wool, zapatos Hugo Boss, los mejores, o de entre los mejores, doctor Pou, entre los mejores cirujanos plásticos, por el precio que yo pagué por mis pantalones y por mis zapatos. Eso es turismo médico. Entonces, esa es la parte del doctor. Entonces el gobierno nos está ayudando a que pongamos esas piezas del rompecabezas en su lugar. ¿Ok? Para eso tenemos a Francisco, para eso tenemos a Waleska y para eso tenemos a Antonio Colorado, para que nos ayuden a que ese mensaje les llegue a ustedes. ¿Y a quién le conviene esto? Le conviene a los individuos, porque se pueden economizar dinero. Le conviene a las compañías, porque algunas son self-funded y tienen que pagar los seguros médicos de su bolsillo. Le conviene a las aseguradoras, porque ellos están pagando un montón de dinero por esos servicios. Y en total le conviene, o sea, this is a win-win situation para todo el mundo. Incluso algunos compañeros de Nueva York nos pueden ayudar a conseguir traer pacientes y podemos hacer un negocio de facilitadores donde hay unas comisiones envueltas que se puede hacer un negocio con amigos de Nueva York para que nos ayuden a conseguir esos pacientes a Puerto Rico. Así que tenemos distintas áreas donde podemos colaborar y donde esto debería funcionar. Ok, les voy a dejar a Francisco en este momento para que haga él tiene un video bien bueno preparado, bien cortito, para que ustedes entiendan un poco más el concepto.
Good morning to everyone. First, I'd like to show you a video with the health industry in Puerto Rico. I am the executive director of the Puerto Rico Medical Tourism Corporation. The Medical Tourism Corporation right now is in charge to develop Puerto Rico as a medical tourism destination, focused in 3 phases. Phase 1 is to certify and train all the medical professionals in Puerto Rico to promote them outside the island. The second phase of the project is the concierge center that the government is promoting right now to canalize all the services and needs of the patients outside Puerto Rico with the local providers. And the third phase is the promotional and marketing efforts focused in three main areas to maximize the Caribbean patients that we already receive in the island. The second one is the US patients with a main focus in the east coast of the US, because in the east coast of the US we have a lot of Hispanic population, and also we have air access to the major cities in that region. And the third region is the Latin American region, but specifically in some places in Latin America, in that places Puerto Rico have an office. For example, Panama, República Dominicana, Colombia, and now Peru. Okay, let me show you the video. And
Puerto Rico's healthcare industry has a state-of-the-art infrastructure. Its services and quality are comparable in all aspects to the United States. However, Puerto Rico offers a more competitive cost structure, offering patients the same healthcare services with savings of up to 60% among other advantages. Puerto Rico has more than 10,000 hospital beds, distributed amongst more than 60 hospitals around the island, of which more than 50 are Joint Commission accredited. We have more than 45,000 healthcare professionals, including surgeons, dentists, and nurses, among others. Specifically, we have over 10,000 surgeons. In Puerto Rico, surgeons need to follow the same regulations established by the United States. Over 80% of our specialists are U.S. board certified. We have a great number of surgeons educated and trained in the best medical centers in the United States. Our facilities have world-class equipment and services. Puerto Rico also has the most advanced oncological and cardiovascular centers of the Caribbean. Our island was a pioneer in complex surgeries such as organ transplants, heart, kidney, and liver. Puerto Rico was among the first countries in the hemisphere to acquire the Da Vinci surgical system. We were also pioneers in the neuroendovascular surgery and highly sophisticated equipment such as the CyberKnife. The island is already positioned as the preferred medical tourism destination among the Caribbean islands' residents. Now is our opportunity to tell the world that Puerto Rico is the better choice.
That's our promotional video regarding Puerto Rico as a medical tourism destination, with hard facts of the medical tourism industry in our island. Right now, we are working very hard with the private sector and the government to develop Puerto Rico in the medical tourism industry. It's an important industry, and we are ready to promote the island outside for international patients to come to Puerto Rico and receive the best medical treatment that they need. So, thank you.
Thank you, Francisco. Okay, we have Waleska. Waleska is going to present a little bit about the cardiovascular hospital, cardiovascular center of Puerto Rico and the Caribbean. Waleska.
Buenos días. Good morning to everyone. It's our pleasure being here today with you to share very important information about Puerto Rico as a medical tourism destination. Our healthcare facilities and our healthcare providers are a very high qualified professionals, and all our facilities have to comply with all the same standards that the U.S. healthcare facilities have too. The only difference is that here in Puerto Rico, our prices are less than the U.S. mainland. And I think that it's a big opportunity for those companies that have self-found their health care insurance benefit for their employees, and also for those patients who have to pay out of their pockets for healthcare services as the dental one. In our case, the Puerto Rico Cardiovascular Center, it's and the only hospital in the island that only dedicates their services for cardiovascular treatment for adults and pediatric patients. And we also have the heart transplant program in the island. And our heart transplant program, it's classified by UNOS between the 5 top programs in the US. Our program have the shorter waiting list in the US mainland, and also we are the only heart transplant program accredited outside US mainland. And our survival rate after 5 years are between the first 3 heart transplant program in the US. We also have the less ischemic time. That is the time of the heart is without receiving blood. So if the ischemic time is short, the opportunity of survival of the heart is bigger. So that maybe that's one of the reasons, plus the quality and the experience of our surgeons, that we have excellent results. And now we have the first patient who was living in Florida and decided moving to Puerto Rico and change from the list of the waiting list of Florida to the Puerto Rico, because in Florida he was like one in the 100 patient. Here he is the third in the waiting list. It's a big difference, and also the cost for the transplant is less, significantly less. All our faculty, it's board certified, because as a condition from the credentialization process, they have to be, and all trained in the US. Some of our doctors went to the school in Mount Sinai, like Dr. Juan Vilaro. Dr. Sin Quintana also went to Mount Sinai, and it's one of our heart transplant surgeons. Dr. Gonzalez Cancel went to the University of Pittsburgh. Dr. Novoa, our medical director, made his fellowship in Mayo Clinic. Dr. Sotomonte, who is the president of our faculty, went to Cleveland Clinic. So we have a very high qualified doctors and nurses and technicians, and we want to share our services to other people that, sorry, I'm the administrative in church this weekend, sorry. We think that we have a very huge opportunity to make arrangement with different business and facilities in the United States. We share the same quality standards, we share a common language, we share many common things that we can approach in order to have benefits for the patient and for the healthcare professional here in the island. Why U.S. patients are going to Colombia or Costa Rica or India to receive services that we know that are not the high quality services that they can receive here in Puerto Rico. So we want to be an option because we are sure that the services, the healthcare services that they are going to receive are better and are the same that the patient is going to receive in the U.S. and maybe for them money, economical part, it's not possible in the U.S. mainland, but it's possible here. It's in U.S. territory.
Thank you, Waleska. I have a...
It is important that you all know that the Centro Cardiovascular is a government facility, but it will be part of our medical tourism program in the first phase of the program, because the Centro Cardiovascular also have an hotel inside the hospital. So that's very important that you know.
This is Howard Johnson. We are located in San Juan as part of the medical center, and our fourth floor is the Howard Johnson Hotel with serving rooms.
It's the only hospital in Puerto Rico that already have an hotel inside the hospital.
They have a beautiful facility with hotel and the whole 9 yards. Eddie?
I had a question. You know, I'm a transplant patient of not the heart, but the liver. 16 years ago, very successful transplant operation. I've been very healthy ever since. One of the key elements, because I speak to people that are looking for organs, is the accessibility of organs. People go abroad for kidneys and all kinds of organs because they're accessible. You know, that's the key. When you're in a crisis, death situation, you need that organ, you go and find it. What is the organ?
I can answer that. Waleska, sorry.
Okay.
I can answer that because I have a good story. I was going to tell a story.
All right.
Okay, this heart transplant. We're in the same list as in the United States, but our list somehow moves quicker. Okay, we just spent 2 months ago at the medical tourism convention, and I was talking to an insurance person, and he talked to me about a heart transplant, and he told me that his friend who's dying because he has not received, he's not up in the list. He's been on the wait list for 2 to 3 years. Okay, and then he said, "Can you get me in can we move to Puerto Rico, change residency from Illinois to Puerto Rico and make this quicker?" And the answer was yes. The transplant list moves quicker in Puerto Rico. It's like a 6-month wait period for a heart. In Illinois, I know that as a fact because I was with the patient. The patient is, I think the patient died waiting for that heart. So the question is, the heart, somehow the transplants is much quicker, less wait list in Puerto Rico. So if you have a friend that needs a heart transplant, like that Jose, el paciente que se mudó, Don Jose, he moved from Florida to Puerto Rico, and he already received his heart in Puerto Rico.
Yes, that's a very good point in reference to the heart transplant. Where do you stand in reference to
Excellent question. The hospital auxilio mutuo it will be the entity that's very advanced in that area, and they're very advanced in the kidney. I don't know. I don't know that answer, but I can get it for you. Yes, sir. Maybe Waleska knows that. What you Waleska? Ah, okay, okay.
I think with me and with Dr. Valderrama is the post, once you get your transplant, your operation, there's aftercare involved. What kind of relationship do you have in case you come here in terms of aftercare?
Well, I have in the clinic. Personally, I work in Salus. It's a clinic that's we have a relationship with Mayo Clinic. So there's all sorts of those connections. I know the Auxilio Mutuo in the cancer area. They're connected with the Houston. ¿Cómo se llama el Houston? MD Anderson. Dr. Cabanillas. He actually treated my dad.
Do you have any aftercare in New York?
Well, those are questions that maybe Waleska knows or the Auxilio Mutuo person will know.
That's part of the coordination that we made with the patient. All depends where the patient lives. Already, for example, we have those coordination in Florida because it's the only experience that we have right now. But definitely, we need to make a networking, and I think that this activity it's a very good step for start those networking with New York.
But that will be part of
That would be part of the work that the concierge center that we are developed under the Medical Tourism Corporation needs to do. The aftercare of the patients that came to Puerto Rico to receive medical treatment and then go to the place that the person lives. So that will be part of our work that we are doing with the concierge center.
If I would recommend, I would say there's only two main hospitals in the metropolitan area, and that's Columbus District area and Montefiore Hospital. If you're linked with them, everybody in the region will come, Jersey, Connecticut, the whole region. Those are the two preeminent, hospitals with tremendous aftercare facilities. Did I get a question?
Uh-huh.
Are we talking here in terms of having our healthcare providers over there picking up the cost, or is this a service that is only on an individual basis that has to lay it out of pocket?
Okay, there's individual basis on things that are not covered by insurances. There's insurance connections that we can do, and there's employee that have a self insured companies that they have to pay out of their pocket.
Are you already, intertwined, or is it relatively?
We're already intertwined. Yes, actually in January we're going to have a big meeting with a lot of.
No, in February we have
February.
We will participate in the executive forum of the Self-Insured Institute of the Americas. So that will be part of our promotional marketing efforts of Puerto Rico as a medical tourism.
Los que vienen a visitarnos, que tú vas a organizarlo.
Also, we will coordinate a fan trip with different self-insured companies to come to Puerto Rico and see in the field the hospitals and all the medical providers.
We're already connecting with them. We're going to have a big government-sponsored event with the insurance companies.
I think maybe it's better that we finish the panel because we may answer a lot of the questions that you have.
Okay, exactly.
Then we shouldn't have to.
This is we feel good. Go ahead, quick.
Yeah, no, I just want to share. I've traveled extensively and have had to have medical, and just so those that are unaware, even if you pay out of pocket, Aetna, La Crosse, eventually you fill out the form, the doctors, and sometimes the doctor certification needs to be
And they'll
translated into
reimburse.
English,
Right.
and they will reimburse you.
Some of
And
them
I
will.
have also received dental care in Puerto Rico by a Harvard graduate, actually. Extremely successful, and I'm very happy. So on that note, I have to go to another event. Thank you
Okay,
so much.
Dr.
Great meeting you, but certainly it's something I highly recommend.
Thank you. We have Dr. Poe. Dr. Poe is an example of our quality doctors that we have here in Puerto Rico.
I'm sort of going back a little bit from what has been already told, and basically we're going to cover what make us equal or equivalent to U.S. doctors in terms of certifications, medical and dental. Basically, okay. Just to give you a little background, and you might already all know this, but just to give a fair background of where everything stands, medical specialties are governed by the American Board of Medical Specialties, and there are 24 approved boards for certification. Most of the doctors, or I should say a large number of us, are certified by this American Board of Medical Specialties, and out of the 24, here in my slides, I basically collected 4 of them. I'm sort of focused a little bit on more of the elective ingredient of healthcare. I know we've talked about organ transplant, which obviously it's something that's very delicate, cardiovascular interventions, which are in most cases delicate interventions that probably need in-hospital or will need in-hospital care. Our organization, Health and Wellness Centers of the America, it's more, or it would be start to focus on procedures that are elective and can be carried out in an outsetting, outpatient basis. So we've collected, and we're in the process of collecting renowned surgeons with high qualifications that will meet the standards of high care. And basically orienting ourselves toward the aesthetic alternative of medical care. Dermatology, ophthalmology, otolaryngology, and plastic surgery, obstetric gynecology offer a lot of the alternatives in aesthetic surgery. So there is, as I mentioned, the American Board of Medical Specialties. There's the American Board of Cosmetic Surgery, which I'm actually part of, which was founded in 1990. It's the only board that examines applicants exclusively in the area of cosmetic surgery. And the certification is reserved for extraordinary surgeons who already have an ABMS, or American Board of Medical Specialties recognized certificate, composed of only 361 members out of 2,500 because of its rigorous requisites. So most doctors here in Puerto Rico that cover for the aesthetic care pertain or are part of distinguished societies as the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, American Society of Plastic Surgery, Aesthetic Plastic Surgery, American Academy of Cosmetic Surgery, and the American College of Surgeons. So as was already mentioned in the video too, most of the hospital here are accredited by the Joint Commission on Accreditation for Healthcare Organizations, which, as you already know, was founded in 1951 and creates some 20,000 hospitals in the U.S. And besides hospitals, it does accredit also doctors' offices, nursing homes, office-based surgery ORs, behavioral health treatment facilities, and home care services providers. There's also a very distinguished organization, which our facility, which it's in an office-based surgical OR, is accredited Accreditation Association for Ambulatory Health Care. We're actually, in our regard, and part of the Health and Wellness Care Center, we're the only office-based surgical OR accredited in Puerto Rico under these standards. And it's an organization founded in 1979, very well respected. It does accredit numerous organizations, including ambulatory surgery centers, dental group practice, office-based surgical ORs, lithotripsy centers, managed care organizations, so a whole gamma of different organizations. It does cover, besides healthcare, other requisites which are needed for to achieve a link and a coordinated care of patients that come from the U.S. So Rights of patients, it's looked over governance, administration, quality of care provided, so you have to fulfill quality improvement programs yearly to be able to comply with this organization. How clinical records and health information are kept, so that's very important for you. And infection prevention and control and safety, along with surgical and related services and anesthesia. So they look over the whole gamma of the medical care. And just to give you a background, according to American Society of Aesthetic Plastic Surgery, in the US, 57% of the cosmetic procedures were performed in office-based surgery centers. So that's a huge number. So there's other office-based which are accredited by the Joint Commission for Accreditation. So we're looking on our organization through the Health and Wellness Center. It's going to comply with high standard doctors that do comply with these rigorous accreditations in order to provide patients with the best care. Hospitals accounted for 14% of aesthetic procedures, surgery centers 28%. And we have dental doctors, which are accredited by the Joint Commission on National Dental Examination. They did comply to get graduated in schools such as Marquette University and New York University, passing national boards of dental examiners in 2 parts. And actually, reading over their credentials, they're soon going to be converting into an integrated exam of these 2 areas. So basically, when patients come down from the U.S., I look at the picture in many ways. So definitely the part of having an economic advantage of doing a lot of procedures, which might be more inexpensive here in the island. But most important, sometimes inexpensive can be expensive. So most important to that, I would have to say I would rely on quality of care. There's a lot of excellent doctors, well trained in the U.S. Mostly, I don't know too many that are trained in Europe, but I mean Europe obviously do have excellent training there, but most are U.S. based, Europe-based trained. So I think quality is very important for you and what you're going to offer your organizations in terms of alternatives. So, questions that are asked on intervention: do I want a dramatic change when I have aesthetic surgery? How long do the results last? How long do I have to recover, as was mentioned here, for post-op care? And just to mention something in that regard, most of our surgeries, aesthetic surgeries, and some of elective surgeries and dental procedures are outpatient surgeries that most recovery times are not long. Actually, we do already have patients in our practice that come from the States for care because they have family relatives here in Puerto Rico. Some of them have moved from the mainland, actually from New York. We do have quite a few patients, and they tell their relatives to come and have care down in Puerto Rico. So I don't know, for some reason they feel at home, and some of them I'm actually impressed. Some people are moving out of Puerto Rico, some of them are coming in. We had a patient that moved in from New York, and she works in an industry next to our office. So we do have quite a number already of patients who are doing that in an informal kind of way. So through the Puerto Rico Medical Tourism and Cardiovascular Center and other organizations, we're actually trying to formalize this with all the details that are needed. And medical tourism sort of sounds like something that is far away, and Puerto Rico, it's basically very accessible to the U.S., and it's the same scenario. Checklist for finding the right plastic surgeon according to the American Society of Aesthetic Plastic Surgery: board certification and credentials, facility accreditation, hospital privileges, thoroughness, report experience, and follow-up care. We've mentioned all that. We do comply with that in the higher standards. Top 5 surgical aesthetic procedures in 2013: liposuction, breast augmentation, blepharoplasty, abdominoplasty, and rhinoplasty, all done by our doctors here in Puerto Rico. Non-surgical procedures: top, Botox, hyaluronic acid, hair removal, microdermabrasion, photorejuvenation. Actually, 4 of those are given out in our center and are given out by other well-respected doctors. So in summary, Health and Wellness of the America, we are actually conforming to a group of doctors which don't need necessarily to step up with a large center with hotels or anything, because the care is being given by doctors who do have already their offices established. So it's easier to start moving the ball along and rolling it as well as the hospitals are tracking down on all their networking for in-hospital care, which obviously it's in great need to and very important. So, there's some type of business that you can sort of establish somewhere else, as I talked to Carlos before. But medical care is something that you really want to have the correct setting, have the correct standards, and have everything set up because you want to give out, you're working with the lives of patients. So we're not working with papers, we're not working with numbers, we're working with patients. So definitely we want to keep that up. And we're actually already accustomed to working with patients with high expectations. So here in Puerto Rico, if you would probably think that abroad somewhere, not necessarily in Puerto Rico, the standards of people might be well below what would be in the U.S. Not in Puerto Rico. Puerto Rico patients, they look for high quality results. It's a small island. Everybody knows what's going on. So you really want to keep yourself at bay and try to do good work. So we'll be more than happy to receive patients from you. There will be a network of doctors who will be integrating into our health and wellness center, and 12 qualified physicians. So welcome here, and thanks for your time.
Thank you, Carlos. Well, to round that up, we're all talking the same language. We're talking quality of treatment first, okay? And then at the end result of that quality of treatment, you're going to get some economical benefits. The patient or the insurance or the company, someone's going to get an economic discount advantage of this. Don Tito.
Normally I don't speak sitting down, but I'm going to do today. Why? Because I have some notes here that I think is better than standing up over there. First of all, thank you very much for inviting me, and it's a pleasure to be here with you. I was here yesterday representing the secretary, and I mentioned some of the things having to do with medical tourism and also educational tourism and all of the advantages that Puerto Rico offers. Now, if you're here, and if you are not here, as many of the ones that are outside of here, you should be interested in what's happening here. Now, why? You should be interested because of one of two reasons, or maybe both. I think the first one is why, how is it going to help me what is happening in Puerto Rico? Now, if you relate to a union, for example, if you relate to any organization which has a lot of employees in New York or anywhere else, you should be interested. Why? Because you can reduce your cost considerably and at the same time offer the same quality of service and an added attraction, which is coming to Puerto Rico, especially for those whose relatives are from Puerto Rico, and especially for those whose relatives are not from Puerto Rico. Because anyway, I'm sure you would like to send them here, enjoy Puerto Rico. If somebody is accompanying the patient, he would come and he can, at the same time, benefit from what Puerto Rico has to offer. And obviously, if the patient has to stay for a number of days, recovering, he can also enjoy that. So I think you can look at it from the perspective of Puerto Rico is giving me a service that I need for my employees, for my members, etc., at a reduced cost with many other benefits and the same quality of service. I think that is what is important. What has been shown to you already is that the quality of the services are good or better. That we have the equipment, that we have the medical doctors, and that we have everything that is needed to give that good service. That's number one, and that is very important. Now, that is going to require that the system gets certified, meaning that everyone, and Paco is working on this, which is making sure that every provider of a service is certified. That is important. And also that we do the marketing in the States with people like you and people, who are involved in the medical service business one way or the other. So number one is the service that we give in Puerto Rico. Number two, which is as important, is I'm a service provider. Can I do it in Puerto Rico? I think this is very important because this is a combination of things that we want to do in the health service that will make Puerto Rico grow and help our standards be better. That will help the people coming from abroad, and it will help the people in Puerto Rico, which obviously is what we want. We want that everybody that comes gets the right service, but at the same time, we will be improving our service, which is already good, because we have an additional demand. So that means that we may need, or we want, people, providers from the mainland to come to Puerto Rico. Now that can be done in many ways. For example, the first thing that is important is that Puerto Rico has a special relationship with the United States where tax exemption can be granted, which cannot be granted in the States. Yesterday we were talking about New York. New York is giving tax exemption from the New York taxes to companies that create jobs, etc. In Puerto Rico, we grant the exemption from federal taxes and local taxes. So that is a benefit that we have. And obviously, for example, a provider can come and create a corporation in Puerto Rico, establish a business in Puerto Rico, and that business will be exempt from taxes, would pay only 4%. So the service will be granted in Puerto Rico, and the provider will be taxed in Puerto Rico only for 4%. If it is a corporation, that corporation will not be taxed in the mainland on Puerto Rican source income.
And that's for 20 years.
And that is for 20 years, and then it can be 10 years more, I think. So again, you have you have a tax exemption paying 4% for 20 years. Now, what kind of service? Well, any service that is related to medical tourism is included. Now, if a doctor comes, or a Puerto Rican who's a doctor who's in New York comes to Puerto Rico and becomes a resident of Puerto Rico, again, he has an additional advantage, which is some of his income will be tax exempt completely, and the service will be at 4%. Except, obviously, this doesn't include U.S. source income or worldwide source income, only Puerto Rican source income. But we have people who are moving to Puerto Rico, becoming residents of Puerto Rico, Puerto Ricans and non-Puerto Ricans, people who were born here who are coming back. So what I'm saying is you have two types of things that you have to look at. How can I be, how can I benefit from sending my people to Puerto Rico, and how can I benefit from doing business in Puerto Rico? Now, the business, you can do it, for example, you don't even have to move to Puerto Rico if you don't want to. You can create a corporation in Puerto Rico that will give certain type of services. You have, let's say, 10 doctors in New York, and then each one of them will come for a couple of weeks, or whichever way you want to do it. One of them will stay here, and the other ones will come, what is it, 4-hour flight? And you're here. You can come for a week, and you can come for a week, and give the service here, and that income will be exempt from Puerto Rican taxes. Obviously, if you're a resident, at the corporation level, it will be tax exempt. You can benefit from that. At the U.S. level, if it's your income and you're resident of the state, then you will have to pay the taxes that you have to pay there. So I think we're talking about two areas that you should look at, and probably maybe you're not interested in them or in one of them. Talk to your friends. Talk to the people in New York. Tell them to call Paco, to talk to us, and then we'll see how we can help them. But there are many, many ways in which this thing can be done to your benefit. I think there are other areas that to improve the image, of the whole system, health system, we're working at. We probably will have a medical tourism hospital soon. We have a friend, Hima San Pablo. They're looking to the possibilities. No, he already has the plans and everything to start a hospital in Palmas del Mar, right next to Palmas del Mar. and it would be dedicated basically to the area of medical tourism. In addition to that, we are looking at different universities, at different hospitals in the States to relate to Puerto Rico, to help us grant even better services. One of the areas which I think it's very important, and we have been talking to the people at John Hopkins, is the preventive medicine. I think, you know, the future of health services is going to depend much more on preventive medicine than on health treatment. So I think we need the treatment always, but if we, you know, do a lot of preventive medicine, probably it will reduce the amount of treatments. That may not help some people, but that's a reality, and it's going to happen. So I think Puerto Rico has to look at the future. We have to really look at all the possibilities, the areas that we can be of, that we can work on, that we can become known by the quality of our professionals and the quality of our services. So I think, you know, you have all of us here. In any way that we can be of help, we will gladly do so.
Thank you, Tito. We already have the first dental office already prepared for medical tourism. You can look at us in the prusahealth.com. There's an app that you hit, and you can get most of the information from us. Eddie, I had to do this. I'm sorry. Forgive me for this, but I had to do this. I had to do this, Eddie. There's a case in the States, 4 implants, 1 acrylic denture. It costs $25,000. Here in Puerto Rico, it costs $14,500. And then with the expenses, it's about $17,950. Okay, any questions from the public now? Go ahead.
I have my family here in Puerto Rico, so for me, what you have said is total sense. So if I am going to invite some of my friends from New York to do this, they will need that concierge service. When do you think that that's going to be fully established and functioning so people can call and find out? And most importantly, if they don't have family here in Puerto Rico, like for example, the plan of having that hospital in Palma de Mar, are you coordinating with local hotels to accommodate these people that will need some sort of recovery, and probably they will need to have some sort of access to care while they're staying in a hotel?
Look at the prusahealth.com, and you can get the link of the hotels and everything. Plus, you can look at the medical tourism. ¿Cuál es el? turismodesaludpr.com. Let me talk to you about that. We've been doing medical tourism for 25 years. I've been doing medical tourism for 25 years. Okay, it's true that we need the concierge because that's going to formalize everything. But right now, if you send me 1 patient, I can take care of that patient right away. Marinela is right there. She will coordinate everything, and we can help you. And if it's a specialty that we don't have in our group, we definitely will move forward and send it to Waleska or go to Auxilio Mutuo. We all have a very good communication, and we can take care of patients right now. Okay, right now, and they'll be in good shape. Okay, the concierge is going to formalize everything, and it's going to round it up. But we can move right now to take care of patients. I've been doing it for 25 years. I just had a patient. He came with the bill of the dentist, or with the proposal of the dentist. And he said, Dondi, they all call me Dondi. He said, Dondi, I know you're not going to charge me this, right? I know, Luis, you know you're going to pay half of this, you know? So he said, do everything that you have to do, Dondi, and let's take care of this. So we did the implants, we did everything. We coordinate the traveling. He had family here, so that the hotel was not a big problem. But the hotels were there yesterday at his presentation, ready to do business. So, and Marianela will coordinate everything from our, and I can help you from our organization. If you don't find a doctor that you need from our organization, I can help you and guide you, and we can start this right now.
I think I want to follow up on his question. I think that when people have cosmetic or aesthetic services, not that it's, the dental is pretty invasive, but it can be very invasive, right? So if somebody comes to Puerto Rico and they want a tummy tuck or some breast implants, whatever, I don't know what your specialty is. Yeah, Botox is a little bit less invasive, but the aftercare and sort of that concierge service for a week or so after would be critically important. And some of those have to be aligned also with medical services. You have to know that should that person have an emergency related to a rhinoplasty or whatever, that they're going to be able to have care. So that's on the horizon.
Right. Well, just to give you a little of my background, I do facial plastic surgery. We are a AAAC certified facility. We take care of these patients basically every week. So the coordination with the Health and Wellness Center, basically it's easy in respect that what the same mechanism that's being used for patients here in the island will be used for patients that are coming from the outside. So in terms of most of the surgeries done for facial surgery are outpatient surgeries in our center. So people would stay at a coordination with on a hotel. Obviously, they do have the phone numbers of myself or the doctor that will be taken care of in case they have an emergency. And us doctors do have privileges on hospitals. So if the patient has to go into a hospital, they'll be taken care of immediately. So as I mentioned in my presentation, obviously quality and safety of the patient, it's highly regarded. For other procedures such as abdominoplasty or liposuction, which some of them might need in-hospital stay, that will be taken care in accordance with the surgeon that treats the patient. So if the surgeon is used to hospitalizing a patient for an abdominoplasty, they'll do the same on the same hospital as they would do with a patient they do from Puerto Rico. Once the patient is able to leave the hospital, then the patient would probably go into a hotel if they don't have family members here. And they will obviously always have the accessibility of finding their doctor. So, you know, there are some non-invasive procedures that can be done, but most of the patients that do come from outside Puerto Rico do come from invasive surgery. So everything, it's really not complicated in coordinating because it's basically what I just said. It's the same mechanism that we use for our patients here. If that answers your question.
It answers my question, yes. And then there's two more. One is on the dental work, you can really see an amazing differential. What about on the cosmetic and aesthetic?
That's a good question.
Yeah, as it relates to the States, because what you see, a lot of the people who do the medical tourism are people who are going to Brazil, or like you said, Costa Rica, the Dominican Republic, and then have, obviously, I'm just curious in terms of the cost.
So we're talking about cost. Sure. Well, I've been revising a cost, average cost from our cost here in Puerto Rico. When you take average cost, you have to you can't talk only New York City. You have to take Kentucky, you have to take Montana. So everything's spread out. So in terms of cosmetic procedures, most of them are more expensive than in the States. 40–60% might be a little bit on the high side. It might not be as much, but definitely there's a big difference. And looking at numbers, most of the difference does take place more on the hospital expenses and the nursing expenses compared to the States. So when you look at the procedure, you can't look only at the surgeon's fees. You have to look at what the patient pays for facilities and anesthesia. And so procedures are more expensive than in the States. Anesthesia is more expensive than in the States. Facilities are more expensive than in the States. So when you sum those three up, for example, a facelift can go up from anywhere from $9,000 to $25,000. When you look at California, you look at New York City. So Probably in Puerto Rico, a high-end doctor will be looking at 10 to 11,000 at most, and there's some other people who would do for more expensive. When you compare it to places like Colombia or South America, then you might be looking at more inexpensive prices in there, depending on where you go. But again, you have to look at quality too. So there's going to be a large discount, but you got to take into account your safety and your results. And the other thing about Puerto Rico is that we're covered by the same medical legal standards that in the States. So the doctors that do operate on you do have to have medical liability insurance, which when you go to a Latin American place, I don't think there's much that exists there. Interesting.
They sell an insurance so that you're covered.
Right. When you
have to
yeah.
pay for that.
So that will be my question. There's going to be definitely a big cut in terms of expenses, and it might vary from surgeon to surgeon or provider from provider to provider, and it'll definitely be of benefit in terms economically, but safety important.
I think the guarantee of being in the United States is very important.
Because of
the federal laws, everything, and the local laws, but everything that is applicable here is the same as in New York,
I
basically.
wanted to add that patient that I know went to Ecuador to get plastic surgery, and there were complications. And the big header was to move that patient to New York, back to New York. So it was like no health insurance, not everything went out of pocket.
Right.
And later on, there was a complication of having admitted that patient into a U.S. facility because, again, there was no connection to doctors in Ecuador. So absolutely good point.
I just had an insurance person was talking to me. He has like 30,000 people that he wants to try to locate over here, and then he asked me for an example of how much he can save. So I sent him an example, and then his reply was, "Oh, Mexico is offering me a better deal. That deal will not make it." And it took me 3 days to answer. I just breathed and relaxed. And it took me 3 days to answer. So I answered him back like in a 3-letter page, 3 pages letter. And then we're talking quality, we're talking loss, we're talking assurances. I even gave him an example that my son goes to University of San Diego, and we decided to go to Tijuana. And we went to Tijuana, and we were driving there, and we wouldn't even get out of the car. You know, and I speak Spanish, I'm Latin, I'm not an American, and I'm talking to a guy from Arizona. So at the end, after he read my letter, he replied back, and he said, "I'm 100%, I agree with you 100%. Let's keep talking about a business." So we're not going to give you the discounts of Mexico. We're not going to give you the discounts of Dominican Republic, but you guys are in New York, and you can get a very reasonable discount on some the medical specialties. We're talking, I mean, in our group, we're talking top-of-the-line doctors. And if in the government, they're picking up the right specialties that we can respond to you correctly, and those are cancer. We have in Auxilio Mutuo, we have the best cancer facilities in the nation. We have cardiovascular surgery, which is like Waleska explained, one of the best in the nation. And then bariatrics is another one.
Orthopedics.
And orthopedics. So we're not talking the whole medicine, the whole medical. We're not competing with the medical specialties. We're picking up the ones that we know we can compete, that the economic gap is so big that we can offer you the quality doctors like Dr. Paul, and the economics that will help either the individual or the company or the insurance company. Who, you know, someone's going to get a benefit here.
Can I ask a question?
Yes.
I'm sold on this concept. I represent about 200 employees that I have that work for me directly, but I'm part of a network for insurance purposes. I'm part of a network with about 2,000 participants. They're all teachers, you know, so that it's easy to market the teachers because they have specific periods in time where they get a couple of weeks off here and there, so it's easy for them to travel. I'm very interested, particularly in the dental piece. Who does my HR person communicate with?
I already sent you an email. You already have my email. You have my. Your wife has my app in her telephone.
I have someone that works on that, so that I'll relay that to my
You-
HR, and I'll recommend it, and I'll see if we can like set up a meeting.
Yeah, definitely. And if we can even work better prices if we have a group commitment. We want to. We're excited. I'm a dentist. I feel a little bit shy in this environment because this is not.
Oh, come on.
Well, in the way that I'm answering medical questions and let's sit down in my chair and I dominate that environment. I don't dominate this one. But
I'm promoting my island, plus at the same time, my employees are getting an excellent deal and a vacation at the same time. That's cost
we're very passionate about this project. Carlos has been receiving emails from me at 3 in the morning, at 4 in the morning. Francisco, I have his email loaded with things. Waleska, we're already going to her center to get an office. And even Tito, we sit down at lunch with him and we discuss everything. So we're very passionate about this project. We know we have a lot of things to offer. We're not offering you, we're picking up what we're offering so that we will do it right. We go slow, but we have Dr. Poe, we have Dr. Lionel Martinez down there, you have me, we have Dr. Melendez, we have the Cardiovascular Center. Those, we have the Auxilio Mutuo, which I thought she could have been here too. I'm sorry to Vanessa. Those we can offer you right now, services. Right now, we can offer you services.
What's your marketing plan in addition to the website and the apps and all that?
We will participate next year in different conferences in the U.S. The first one is the Self-Insure Institute of the Americas Executive Forum in February. But also we have an aggressive marketing and promotional efforts in the U.S., mainly in the East Coast, focus in the self-insured companies and the patients that don't have insurance, and also different companies that are self-insured companies. But we are working on develop a great web page that the patient can book the different doctors that they like to
This is a joint venture between government and private sector.
Yeah.
So we're in the private sector. We're moving. Like I said, we have the app. You look at it, and there's all the information about us there. But we're working with them so that we have they call it a país. ¿Cómo es que lo llaman? País, a vision of the país, una visión de país, una visión de país. So
we will have different meetings in different states in the U.S., mainly in the New York, Washington D.C. We will have a meeting in Florida with different doctors that right now receive patients, attend patients, Hispanic patients, to promote the efforts that we doing right now in Puerto Rico, and saw Puerto Rico as an opportunity for the referrals of deaf patients to the island.
Yeah, I think from a marketing perspective, you have to almost go, well, we'll talk about it later.
Okay.
That's a great answer.
Okay.
That's a great answer, thank you.
Okay.
And just from a marketing point of view, I'm also the state director of BLULAC, in the state of New York.
Okay.
BLULAC.
The National Education Committee
Okay.
for the BLULAC National.
Okay.
And we reach out to 32,000 plus people across the country. So it'd be nice to see if we can put something in our newsletter, which is true.
Eddie, we can do. We're excited. We'll do whatever needs to be
Of
done.
course. And also, you have a meeting that you like to we make a presentation presentation to the members of the organization, that will be perfect for us.
Give us your contacts and we'll send you information. ¿Tienes los contactos, Marinelli? Okay.
May I ask you, you have a list of members' emails
Yeah, because that will be the easiest way. I mean, if you have a database of emails of your members, I'm sure the government here and the private sector can start sending some information, and you can pack that up, and that will be the easiest way for people to. Some people more rely on emails these days than they do on paper mail, so they can get all the information right away, and that will be an easy way. So if you have a database of emails that you somehow can get in contact with us, that will be great. Yeah, sure.
I should have mentioned Honorable Lucy Arce. She's a senator in Puerto Rico. Lucy. Sorry. Well, I think it's all your questions answered more or less what we could. Estamos bien, terminamos. Muchas gracias a todos ustedes. Thank you, doctor.